live on Facebook, and we'll give folks a minute here to get on. I have my Facebook going here, and we've got the other side there. Okay. Let's see, we got about 4 people on. Evan looks like he's on. We're getting a few others in here. That's good. We'll give folks a minute to log on here. All right, and we're seeing lots of folks logging on now. We even have greetings from Ohio, Dr. Sevilla from Salem Family Practice. Welcome. And Shelly. See lots of people joining in. Good. Getting a few thumbs up even. All right. And there's Raul joining in. Fantastic. Excellent, excellent. There we go. See lots of people joining on now. That's good. All right, well, why don't we go ahead and get started with this evening's program. Welcome everyone to CAFP's Community Conversation tonight as we get to honor our 2020 CAFP and CAFP Foundation Award winners. This is really one of the highlights of the year for us, but I am Dr. David Bozzo and I'm your CAFP president. And I'm joined tonight with my colleague and friend, Dr. Marianne McKennett, who is the CAFP Foundation president. Welcome, Marianne. And although we aren't able to celebrate these winners in person this year, we wanted to spend some time to recognize their incredible accomplishments and steadfast work for family medicine in California. These awards are given in 4 categories. We have the CAFP Foundation Award for Family Medicine Resident of the Year and the Barbara Harris Educational Excellence Award. And we have the CAFP Awards of the Hero of Family Medicine Award and the Family Physician of the Year Award. For our viewers on Facebook tonight, please share your words of congratulations, encouragement, and memories of the award winner in the chat. We would love to see them. And while we won't be taking any questions this evening, we do encourage you to chat with each other while you're on Facebook. And if you have a special message for our award winners, let us know and we'll make sure to share that with them. Thanks again for joining us and being part of this special evening. So without further ado, let's begin. All right, so Dr. Marianne McKennett, would you like to introduce our first award winner?
Absolutely, my pleasure. Thank you, Dr. Bozzo. I'm especially honored to introduce our first award for the 2020 CAFP Foundation Family Medicine Resident of the Year. And this award goes to Lalua Bharanwala. Lalua is an inspiring leader in both her residency program and the academy. Over the last 2 years, she has been instrumental in the initiatives of the CAFP's Resident Council, which is a statewide group that works to promote and advocate for family medicine residents and their interests. As she completes her final year of residency, she continues to provide unparalleled inspiration and support to her peers. Her contributions range from scholarly activities to advocacy work and mentoring, and teaching medical students during procedure workshops. Lalua is actively engaged in her residency program's primary care residency program collaborative project, learning about and now prescribing and managing medication-assisted treatment for patients with substance use disorder with a focus on the opioid epidemic. She has also been a recipient of an all-member advocacy meeting scholarship and a 2-time poster presenter at the Family Medicine Clinical Forum, even this year via Zoom. Beyond Lulua's academic success, she is an engaged learner whose extraordinary compassion, intelligence, motivation, and willingness to help others truly sets her apart. She is well deserving of this award. And in fact, Lalua is a graduate of the first class from Emanate Health Residency Program, one of the newer programs in California. And she's participating this year at Kaiser Fontana as their community medicine fellowship participant. Congratulations, Dr. Bharanwala. I will turn it over to you for a few remarks.
Hi, thank you, Miss McKennett, and thank you, Dr. Bazo, for that introduction. I had a guest visit me throughout just right now. I am humbled and extremely grateful for this award, for this opportunity that California Academy of Family Physicians has provided me. Right from giving me an opportunity to attend the all-member advocacy meeting last year, attending the resident leadership workshop early on, and then being a part of the resident council has really given me an opportunity to learn about advocacy and resolution writing and learning the inner works of CAFP. And I'm very, very thankful and very grateful to my residency program, Emanate Health Family Medicine Residency, for giving me this platform and giving me a supportive residency program to showcase my abilities and work in collaboration with them. I've been very fortunate to be a part of the CFP's grant with the MET program, with my residency program, and I have firsthand seen the benefits that we've been able to give our patients. There's a lot more work to be done. I do want to thank my family, who've been my rock through these years of residency and now my fellowship. And I'm hoping because there's so much work left to be done and so much we have to do to serve our patients amongst this pandemic and even so forth, that we all do it together. And I appreciate all the support, and I do hope to continue to make everyone proud further. Thank you again for this award, and thank you and have a great day.
Fantastic. Congratulations, Dr. Bharanwala. Thanks for all that you're doing for CAFP, and I am looking forward to all the great contributions that you will be making in the future. Congratulations.
Thank you. Thank you so much.
Now, I have the honor of announcing this year's Hero of Family Medicine Award winner. This award goes to a CAFP member who has gone above and beyond the call of duty to advocate for patients, colleagues, and the family medicine specialty. This year's winner of the California Academy of Family Physicians 2020 Hero of Family Medicine Award is Erica Roshan Ravan. Erica moved from Washington State in August of 2018. From the moment she came to California, she has been advocating for our family physicians and patients. When the anti-vaxxers came out in full force, she headed to the Capitol to testify in support of immunization legislation and represent CAFP in a vaccination advocacy video. With elections coming up, she not only donated to the FP PAC, the Family Medicine PAC, she attended numerous fundraisers representing us, including for Assemblymember Anthony Rendon and Senator Richard Pan, MD. She also helped support the Women's Caucus at a Women of the Year event for legislators. As the public charge rule was rolling out, Erica spoke with reporters about the adverse effect it would have on our patients and was quoted in the Sacramento Bee. Her external advocacy was equally matched by her internal work on behalf of family medicine. She has helped to usher in a reinvigoration and merger of the local Sacramento YOLO chapter of CAFP. And as the local chapter president, she launched a speaker series to discuss everything from health to homelessness. She is a delegate and a co-convener for the AAFP National Conference on Constituency Leaders and a member of the CAFP 2019-2020 Ready to Lead Building Women Family Physician Leaders class. The list goes on and on with Erica. That is why, because of her dedication to CAFP, her patients, her community, and family medicine, we are so proud to award Dr. Erica Rashaan Ravan our 2020 Hero of Family Medicine Award. Congratulations, Erica, and we would love to hear from you.
Thank you so much, David, and thank you everyone for this huge honor. I'm truly humbled to be receiving this award, and I can say that for sure these last 2 years with the CAFP since moving to California have been quite a fantastic adventure, and I do not exaggerate when I say that all the opportunities I have been given, all the things I have learned, the community that has been built, the shared wisdom, the inspiration, and the friendships I have gained from the CAFP way outweigh anything I could ever put into this endeavor, and I'm truly very grateful for that. I'm also very humbled by all the support I have received over these past 2 years from the CAFP staff and my colleagues. And I want to highlight a few people, in particular my predecessors in the chapters here locally in Sacramento, and Drs. Carla Kakutani and Dr. Warren Brandley, who have entrusted me with leading these 2 chapters into a merged new Sacramento Valley chapter, and by enthusiastically supporting me. I also want to thank Dr. Steve Mandura, who joined the Sacramento chapter in 1984 and recently joined our first annual virtual meeting enthusiastically, and then wrote us the history of our chapter up for us to keep. And particularly thankful to all of the CAFP staff. You guys are going above and beyond. You're just truly amazing. And you have answered a gazillion and then some questions from me over these past 2 years. And I'm just truly very grateful for all that you have helped with. Thank you to Ed and Shelley and all the incredible physician women leaders in the Ready to Lead Fellowship that concluded yesterday. I can't even start to tell you how many things I have learned from all of you. And thank you to everyone in the California delegations, to NCCL and the Congress of Delegates, as well as the NCCL delegations to Congress of Delegates, and everyone sitting on the commissions I was honored to serve in. We have spent so many hours brainstorming and some very tense emotions and laughters and tears, and I truly appreciate all those times we have spent together, and the many anecdotes that I could share for a few hours to come, but I was told I didn't have a few hours to talk right now. And thank you to Sabrina Bazo, who is the Executive Director of the San Diego chapter, for all her wisdom and her help support bringing our new merged chapter here in Sacramento off the ground. And my husband Babak, a very special thanks for keeping many of my evenings and weekends child-free, and for my children for not giving him too hard of a time during those times. Thank you to the leadership and my colleagues at CommuniCare Health Centers. You're all such a great mission-driven group that is working tirelessly on behalf of our patients, the patients we serve. And a very special place in my heart has my board here in the Sacramento Valley chapter, our new board built a year ago. Dr. Bria Bondi-Boyd, Tim Takagi, Ava Asher, Kim Bus, Toussaint Mears-Clark, Enke Tushing-Dox, and Jessica Fortin, Michelle Daw, and Alicia Hobbs, all of whom have spent immeasurable hours and energy creating and realizing our vision of an active, engaged chapter on behalf of family medicine and our patients and our physicians and students. And I just want to conclude with a brief reflection on what an extraordinary time it is right now to be receiving an award as a hero in family medicine. And granted that I was going to be receiving this award at the beginning of March, before we had much of an idea of what was coming. And then the world turned upside down, and signs were popping up all over the place about healthcare workers as heroes. And I have to say, for me, none of it has felt particularly heroic in the last few months. It's much rather an unsettling exercise in uncertainty, and it's not something I particularly appreciate. And I don't think most physicians particularly appreciate feeling like we don't know where this is going or what we are doing. But despite all that, I truly think there's so much opportunity also. We are facing extraordinary public health crises with the unprecedented challenges from COVID-19, as well as the systemic racism. And as family physicians, we are highly trained to think in big systems and to listen to people, and we have such privileged insights into the lives of our patients that I truly feel like that's giving us a unique position to be leaders in moving our country forward during this crisis. And I feel so privileged and so grateful that all of you are in this together with me, and your support and friendship really means the world to me. And each and every one of you enriches my life as a physician and as a person. And I truly look forward to continuing this work with you. Thank you.
Thank you, Dr. Roshan. Well, congratulations on this such a well-deserved award. And I really look forward to the opportunity to work together in the future. You've been really inspiring just in your acceptance speech. Thank you. Our next award is the CAFP Foundation's 2020 Barbara Harris Award for Educational Excellence. And I have the honor to recognize our award winner, Dr. Christopher Flores. This award recognizes that Dr. Flores has been a leader in CME for many years and is a champion of researching and providing the best education based on effective adult learning principles and practices. He is a creative thinker and early adopter when it comes to education outside the box, and has been an invaluable member of the CFP's Committee on Continuing Professional Development for over 12 years, and he's been the co-chair for the past 5 years. This work is particularly important in our new remote learning age. Chris jumped headfirst into this digital era and continues to provide the CFP with information and ideas to improve educational offerings through the digital world. He continues to be one of the CFP's go-to faculty members for many of the initiatives they have undertaken, including the large Team A National Collaborative addressing anticoagulation and therapy for atrial fibrillation patients, where he presented to sister AFP chapters across the country. I personally took part in that training, and it really actually made me rethink my practice patterns. He is passionate about senior care and has done research and presented on topics such as senior wellness and dementia care. Despite a very busy private practice, Chris has even found time to provide grand rounds at White Memorial Medical Center, where his lectures on geriatrics, dementia, and Alzheimer's disease prevention have received some of the highest evaluations by faculty, residents, and nursing staff. His passion for education goes beyond sharing his expertise with colleagues. He is very active in his community, where he has received numerous awards, including the Palm Springs Human Rights Commission's Annual Community Service Award. Chris participates in Walk with the Doc, Coachella Valley Small Business Development Center, fireside chats, and volunteers countless hours to ensure patients are provided with excellent education and resources to answer their medical questions and help them stay healthy. True to the principles of family medicine, Chris' work brings home the message that the word doctor has its roots in the Latin docere, to teach, and so is very deserving of this very distinguished award. Unfortunately, Dr. Flores is unable to join us this evening, and he has sent us a recording that we will share with you now.
Hello, everybody. Sorry that I couldn't be there live on this web meeting, but I definitely wanted to express my gratitude and appreciation for being selected for this award. It's a real immense honor to be chosen for this Excellence in Education Award. And I do have to say that when I first got the email from Shelly Rodriguez, I thought that there might have been a mistake because it just it kind of came out of left field, and I didn't expect it. I guess my imposter syndrome, acted up, and I was thinking that I didn't really deserve it. But I got on the phone right away, and I called Shelly, and I talked to her, and she reassured me and confirmed that yes, in fact, I had been selected for this award. And so I am very, very honored and pleased about getting it. Even so, I still wonder if I fully earned this recognition, especially when I looked at the list of the previous winners. A lot of people I know, and some of these folks have made immense contributions to medical education and to their institutions where they have leadership roles and things like that. And I'm kind of a solo physician with almost 99% of my time doing primary care practice. So I do medical education at night and on the weekends when I have time. But I really, really appreciate this award, and I just wanted to give a shout out to a few key individuals that have helped me along the way. I was very lucky in medical school at UC Irvine to work under Dr. William McMillan Rodney, Bill Rodney, who many of you probably know or have heard of. He was at UCI back in the 80s, and then now he's been in Memphis, Tennessee for a long time. But between him and then my residency director, Jimmy Hara, who is also another brilliant fund of knowledge and an incredible teacher, both of them just instilled in me this ethic of education. It was an expectation that part of my job and part of my being for the rest of my career would be to teach. So whatever other professional aspirations, I was attempting or getting into, teaching was going to be core part of whatever I did, and I've maintained that throughout my career. I also want to recognize Dr. Roger Cady and his administrative director, Sandy Billmeyer, who were part of an organization called the Primary Care Network that some of you may be familiar with. They did a lot of teaching around areas of migraine and irritable bowel syndrome, and I learned a tremendous amount about education and about effective communications and public speaking from them as well. And of course, for the last 15 years, I've been very active with the CAFP and the CCPD, the Committee on Continuing Professional Development. And so I've worked with fabulous people like Susan Hoagland and Shelly Rodriguez, Jerry Davis, Cynthia Keir, Mary Alice. There's a lot of others that I could name. I've worked in a lot of different CME organizations and a lot of different hospital settings and health organization settings, and I've never met a more wonderful group of creative, innovative, and resourceful individuals. So we're very, very lucky to have that administrative team with CAFP. And then, of course, my CCPD committee colleagues, which, Carol Havens is just, an incredible, amazing teacher and educator, and I've learned so much from her. I think we all have. And then other people on the committee. I mean, there's been numerous people over the years. I would just maybe mention Tom Bent and Dave Bazzo, Lee Ralph, Will Wu, Karen Wachowski, Liz McCraven, Kim Dwyer. These are people that are just very passionate about communication and education, and I've learned a ton from them as well. So thank you to all, and I guess if there's one thing that this award means to me, it is this. It's a catalyst for me and all of us to do more, especially in this new world that we're in, this COVID reality, which is requiring virtual learning and online education. And then, because of the pandemic, it just seems to have exposed more and more the systemic problems within our healthcare system and within our society as a whole. The institutionalized sexism and racism and homophobia and all the social determinants of health that we have to consider when we are seeing patients and advising treatments. So we have a lot of work ahead of us. We have a lot of challenges ahead of us. And like I said, this award will be a catalyst for me to continue to work and work with the CAFP and other organizations. So once again, thank you to the CAFP and to everyone that was involved in selecting me for this award. And once again, I'm sorry that I couldn't be live with you all on this web meeting, but I look forward to seeing you all soon. Thank you.
All right. Well, first, congratulations to Dr. Flores. What a tremendous asset he is to have here and work with family medicine. And of course, true to form, even in his comments, Chris is one of the most humble guys that you will meet. He is a superstar and he really deserves this recognition. And I, for one, am so happy that he was honored with this award this year. And Chris, I look forward to many more years working with you and the incredible impact you have had on family medicine and our family physician members here at CAFP. All right, finally, tonight, I have the honor of introducing our 2020 Family Physician of the Year. Drum roll, please. Dr. Jeremy Fish. Now, for those of you that know Jeremy embodies all of that this award recognizes. A family physician who presents the finest characteristics of family medicine and is directly and effectively involved in public service and activities to enhance the quality of life for patients and communities in California. As program director and co-founder of the John Muir Family Medicine Residency Program, he models the way for family medicine residents by providing exceptional care in a state-of-the-art, team-based care model he designed and shepherded through accreditation. In this regard, he has become an authority on every area of strategic interest to CAFP, including payment reform, practice transformation, and the primary care workforce. He has offered to share this expertise with CAFP throughout the years by participating at every level of the academy, from informal interactions with staff to stellar work as a member of the CAFP Board of Directors. Jeremy is an advocate for his profession, his patients, and his community. He has participated in numerous CAFP lobby days and all-member advocacy meetings with legislators, and providing testimony before state committees and public commissions, such as the Song Brown Healthcare Workforce Commission. He was instrumental in guiding and the development of the CalMedForce GME grant program, informing CAFP's feedback on the advisory council. And his vision led to the development of the CAFP residency network, which has grown alongside the number of family medicine residency programs in the state to more than 50 members. He has also participated in the GME Initiative, a network of Western residency program directors and stakeholders concerned with federal reform of GME. Jeremy is an enthusiastic teacher and sound clinician who always creates a comfortable and welcoming learning environment for medical students and residents. He also has a very deep respect for the underserved and vulnerable patients to which he has dedicated his career. Despite having many years of clinical experience under his belt, he remains a humble practitioner with a very healthy curiosity and enjoyment of learning, which he loves to share with both medical students and residents. He has undoubtedly been responsible for the development of hundreds of dedicated family medicine physicians. As a physician leader, Jeremy is willing to be on the cutting edge and traverse difficult yet rewarding pathways to advance family medicine. He is fair, open-minded, and practical. He makes it a priority to be present in administrative and clinical environments and always maintains an open door policy. He even makes himself available to residents outside of clinical hours, as he is a tireless advocate for any resident. As a member of the FP PAC board, he has been directly responsible for increasing the number of contributions from members to the PAC, and thus CAFP's influence in Sacramento. Jeremy Fish exemplifies the values of family medicine: patient-oriented, community-based, team-centered, high-quality primary care for the most vulnerable populations, and is most deserving of this award. Congratulations to my colleague and friend, Dr. Jeremy Fish. I'm going to turn it over to you so we can hear from the man himself.
Wow. Well, thank you, David, and thank you, CAFP and the community. I'm truly humbled by this presentation and this honor. I have really looked forward to every day that I'm a family physician, and it's been a long journey, and it's just been marvelous to hear Erica and Lalua and Chris Flores describe their enthusiasm and their energy around family medicine. It just reinvigorates and restores and replenishes my sense of the passion and devotion that we all bring to this field. Chris Flores, for example, was personally inspirational to me. I shared medical school with him at UC Irvine, and knew Bill Rodney, and Chris Flores and David McDonald were instrumental in really drawing me towards family medicine, because they were just such substantial, humble, generous, and inspiring people. I just thought, well, that's the kind of person I want to be. And I think so much of what we do is we follow people who inspire us to be something more than we can be just by ourselves. And so it's been a tremendous and fantastic adventure, as Erica stated. This journey of family medicine is really a never-ending one. We're all part of a river of people who are bringing our resources and our experiences and our life and our skills and our hard work and our dedication to the community, no matter what the community's needs are. That's one of the things I think is particularly special about our specialty, is that we really mold ourselves to the communities we serve. We don't expect the communities to mold themselves to the services we provide. And that's very different from a lot of other specialties. We have a very open door process. We will see anyone. We see people with all kinds of undifferentiated conditions coming to us from all kinds of financial and ethnic and cultural backgrounds. And we welcome them all into our small, humble space we call our exam room, and to sit and listen to their stories, which enriches our lives and allows us all to provide services and opportunities for people to discover what's happening to them and how we might be able to help them in some small way. Often, I think, as I look back in my career, I'm at that phase where you do a fair amount of looking back. And I think curiosity has probably been my greatest gift that I've been able to provide across the many spheres of family medicine. I kind of like to describe it as being a teacher, being a leader, and being a clinician. TLC, that's our tender loving care that we provide to our communities that we work with. And I found that curiosity allows me to remain open and to come with questions. And that every time in my life where I face uncertainty with curiosity and a little dose of courage, usually, that those two things together just open up vistas and allow for so many things to happen. I think back on the creation of the California Residency Network, and although I get a lot of credit for that, that was the work of many, many people. And I can remember Jeff Haney, Walt Mills, Tim Munzing, Hector Flores, and Jeff Luther and I sitting, and it began with kvetching, which is where a lot of great things come from. We were kvetching that the only time we met every year as program directors was to compete with each other for a a small amount of funds through the Song Brown funding at that time. And at one point, we sat down with Callie Langton, who was a CAFP director of workforce at that time. And we said, you know, we got to do something about this, Callie. We can't keep just meeting once a year. We have to find something more about us as program directors. It's kind of a lonely job sometimes being a program director. And we're constantly competing with each other for students. And so we finally sat down and decided to have a statewide session that CAFP, thanks to the support of Susan Hoagland and Adam Francis and Shelley Rodriguez, three just incredibly stellar people who have been the continuum in many ways of the CAFP in my time with CAFP, that they had enough courage and curiosity themselves to see what we could produce, that we put together a statewide workshop, and through that workshop evolved the California Residency Network, the CAFP's California Residency Network, which grew along with the medical student and resident version of that, was called Building Bridges at that time. And we were able through that process to transform ourselves from 50 program directors who were all competitive and didn't like to share our vulnerabilities into 50 friends who were all passionately advocating for us to get more funding and more support for something that is near and dear and that we cherish, which is the education of medical students and that transformation from a medical student into being a full-fledged family physician. And that is the great journey that I have been most passionate about my entire career, has been to watch and wonder as these young students go through the trials and travails of residency and come out the other side just these beautiful, amazing, committed family physicians who dedicate themselves to taking care of anyone who will come in the door. And so I've been able to participate in many advocacy activities that have all been inspiring for me. And I enjoy doing them because I get around all of these family physicians, and there's just something delightful about a collection of family physicians that has just continued to inspire me. And so I, now I'm very fortunate to be part of a new residency program that I don't think I could have created that were it not for the work of the CAFP that we had done earlier, and the funding resources that we've been able to garner. I mean, the CAFP really drew up dramatic ways to augment funding. I told you about Song Brown. We used to compete for $2 million, 50 programs. Now there's over $33 million every year available. And that's because of the dedicated hard work of the CAFP staff and all of the program directors. So it's indeed a great honor. I'm deeply appreciative. I'm particularly grateful to the staff and the team at CAFP, the board of directors, the CAFP Foundation, the CAFP PAC, and I think that this has been one of the most wonderful experiences of my life, and I'm just grateful that people acknowledge me as a teacher and a leader and a clinician in this age of COVID, where so much is sad and hard for us and so uncertain and fearful, that I think through curiosity, that's a way to turn a fearful anxiety about the future into a curious discovery. And I think as long as we can keep maintaining that curiosity, there's always something we can do to help people. And I'll leave you with that, and thank you all very much.
With that, congratulations, Jeremy. I'll just say that I have so appreciated your visionary leadership and bringing the program directors in California together. It's really been extraordinary to see you at the helm. And anyway, true congratulations. And also congratulations to all of our 2020 award winners. Just, yes, some virtual clapping here. And I'm just thinking myself here as with 30 years as a family physician and family medicine educator, I also reflect that we are facing such challenging times, both medically and socially, challenging and uncertain times. And I think it's particularly hard because we can't really be as together as in person as we usually are in difficult times. So this has been a great opportunity, at least to bring us together here tonight. And I will say that I am both inspired and hopeful when I hear from these CFP family medicine leaders and award winners. So, thank you for those that are carrying the torch forward for family medicine in California. I also think as family physicians in California, we are so very fortunate to be part of such an active and supportive academy. I mean, the work that's done, I guess, in some ways behind the scenes by the academy staff is just amazing. And I think that sometimes they are really the unsung heroes of family medicine. We all work closely with Shelley Rodriguez, Adam Francis, Lisa, who couldn't join us tonight. And a special thanks just for tonight's activity to Josh Lunsford, who's been very much behind the scenes, but making this activity come together and run very, very smoothly. So thank you. So thinking ahead, I encourage everyone, all of you, to submit nominations for the 2021 awards. These award nominations will be accepted beginning November 1st with a deadline in late January of 2021. And if you have questions about that, visit familydocs.org for updates and answers to any questions. And as you can see, it's really important for us to recognize our leaders and in family medicine, and to encourage our residents and our students to continue forward in active roles in the academy and in family medicine. So please, these awards are a way that we can recognize these sometimes unsung heroes. So I just want to give my congratulations again to all of our incredible award winners. And thank you all for joining us tonight live on Facebook. And good night and be well.
Thanks, everyone. And congratulations to the award winners. You guys all rocked it. So proud.
Thank you.
Thank you.